The hidden sleep mistake that could be raising your blood pressure overnight. Most people think blood pressure rises because of what they do during the day. Too much salt, too much stress, too much coffee, not enough exercise, too much weight around the belly. And yes, those things matter, but here is where people get fooled. Your blood pressure may also be rising while you are asleep, because your body is not actually getting the kind of sleep that lets your heart and blood vessels relax. The hidden mistake is not simply going to bed late. The hidden mistake is treating sleep like it is only about hours, while ignoring what is happening to your breathing overnight. You may be in bed for 7 or 8 hours. You may think I slept all night. But if you are snoring heavily, waking up with a dry mouth, gasping, breathing through your mouth, or waking up tired, your body may not be getting peaceful sleep. It may be fighting through the night, and that can matter for blood pressure. Normally, blood pressure should dip during deep, restful sleep. Your nervous system calms down, your heart rate slows, your blood vessels get a break, your body enters repair mode. But if your breathing is repeatedly interrupted during sleep, that nighttime dip may not happen the way it should. Sleep apnea affects oxygen levels during sleep and is linked with higher risk of high blood pressure, heart attack, and stroke according to the CDC. This is where it gets interesting. The problem is not just snoring. Snoring can be a clue, but the deeper issue is stress inside the body. When breathing becomes blocked or shallow, oxygen may drop. Your brain senses danger and wakes the body just enough to restart breathing. You may not fully remember waking up, but your nervous system does. Each interruption can trigger a stress response. Adrenaline rises, blood vessels tighten, the heart works harder, blood pressure may surge. Now imagine that happening dozens of times in one night. You wake up and think you simply slept poorly, but your arteries may have spent the night under pressure. Most people miss this because they expect sleep apnea to look dramatic. They imagine someone loud, overweight, and obviously gasping for air. But after 50 or 60, sleep breathing problems can be more subtle. You may only notice morning headaches, dry mouth, brain fog, daytime sleepiness, high blood pressure that is hard to control, or waking up several times to urinate. And this is why that matters more with age. Blood vessels naturally become less flexible over time. Many people also develop insulin resistance, weight gain around the neck or belly, nasal congestion, medication changes, or weaker airway muscle tone. All of that can make nighttime breathing less stable. The American Heart Association notes that obstructive sleep apnea has been linked to higher rates of high blood pressure, stroke, and coronary artery disease. That does not mean every person who snores has heart disease. But it does mean snoring with high blood pressure should not be ignored like a harmless habit. Here is the part many people never connect. If your blood pressure is highest in the morning, your sleep may be part of the story. A person may take medication, reduce salt, walk daily, and still wake up with high readings. They may feel frustrated and think, "What am I doing wrong?" But the problem may not be only daytime behavior. The body may be spending the night in a repeated stress cycle. That sounds small, but it matters. Because blood pressure is not just a number at the doctor's office. It is pressure on the artery walls. If that pressure stays high at night, the heart and blood vessels lose their recovery time. Another clue is waking up tired even after enough hours in bed. This is one of the biggest warning signs. Restorative sleep should leave you at least somewhat refreshed. But if you wake up exhausted, heavy-headed, irritable, or foggy, your sleep may be fragmented. You may not remember waking up because many breathing interruptions are brief, but your body keeps the score. Some people also wake up with a pounding heart, sweating, or a feeling of anxiety. Others wake up with a dry mouth because they have been mouth breathing all night. Some notice morning headaches. Some wake up 2 or 3 times to urinate because poor sleep breathing can affect hormones and pressure changes that increase nighttime bathroom trips. This is where people get fooled. They blame the bladder, they blame age, they blame stress. But sometimes the root is sleep breathing. Now, sleep apnea is not the only sleep-related reason blood pressure can rise. Regular lack of sleep can also contribute. Mayo Clinic notes that consistently getting too little sleep may lead to high blood pressure in adults. So, if you sleep only 5 or 6 hours most nights, your body may stay in a more activated state. Stress hormones may remain higher. Appetite and blood sugar may worsen. Weight may creep up. And over time, the whole system becomes less blood pressure friendly. But the hidden mistake in many older adults is this: they focus only on getting more hours, while never asking whether their sleep is actually restful. So what should you do? First, look for the pattern. Do you snore loudly? Has anyone told you that you stop breathing, gasp, choke, or make strange breathing sounds at night? Do you wake up with dry mouth or headaches? Do you feel sleepy during the day? Is your blood pressure higher in the morning? Do you wake up several times to urinate? Do you feel tired even after a full night? If several of these are present, do not just buy a new pillow and hope it disappears. Talk with your clinician about whether a sleep study makes sense. Second, do not assume sleep apnea only happens in people who are severely overweight. Weight can raise risk, but it is not the only factor. Age, neck structure, nasal blockage, alcohol at night, sedating medications, sleeping on your back, and airway anatomy can all contribute. Third, be careful with alcohol close to bedtime. Many people think alcohol helps them sleep because it makes them drowsy, but it can relax airway muscles, worsen snoring, fragment sleep, and reduce sleep quality. That means your body may look asleep while your breathing becomes less stable. Fourth, pay attention to sleeping position. For some people, sleeping flat on the back worsens snoring and airway collapse. Side sleeping or slight elevation may help, though it is not a substitute for proper evaluation if symptoms are strong. Fifth, keep a consistent sleep routine. Your blood pressure follows body rhythms. Irregular sleep, short sleep, late meals, nighttime screen exposure, and stress before bed can keep the nervous system more alert than it should be. And finally, if you already have high blood pressure, especially if it is hard to control, ask whether sleep quality and sleep apnea have been considered. This is not about replacing medication or ignoring diet. It is about finding a hidden driver that may be working against you every night. The body is not supposed to spend sleep in fight or flight mode. Sleep should be the time when your heart gets a break, your blood vessels soften, your brain clears waste, your hormones reset, and your blood pressure calms down. But if your breathing is interrupted all night, sleep becomes work. So remember this, the hidden sleep mistake is assuming that being in bed is the same as truly recovering. If you snore loudly, wake up tired, wake with dry mouth or headaches, feel sleepy during the day, or see high morning blood pressure, your body may be telling you that your nights are not as peaceful as they look. Do not ignore that signal, because sometimes the most important blood pressure habit is not what you do at breakfast, lunch, or dinner. Sometimes it is making sure your body can breathe, rest, and finally lower the pressure while you sleep.